so much. So I don't know if this is giving women the last word, but I thank my colleagues. They gave absolutely terrific talks. And my first question before I'm popping mine up here is, can those people who are parents or who themselves have APS-1, please raise your hands?
Parents of or.
Okay, so I'm going to be turning and speaking to all of you because I want all of you to hear this message. How many of you have children or are relatives of children? That is to say, kids under the age of 18 that are living with APS-1. Okay, so I'm going to give you today the pediatric perspective of exactly what my adult colleagues talked about. Okay, so I am going to give a quick declaration. I don't have any conflicts of interest pertaining to this talk or to my participation. And I would actually encourage you to share the slides with your treating physicians, because I think they're just major messages that need to get out. And you know, what I have learned is that patients are wonderful educators, and it's really important that you take an active role in that relationship with your physicians. Okay, I'm going to do this as a series of rules. And since I'm coming down, I actually started driving down here on the 4th of July and saw wonderful fireworks displays in the evening. I thought I'd start with a Benjamin Franklin quote as my first rule. An ounce of prevention is worth a pound of cure. Okay, so here are my prevention solutions and tips. Follow the treatment plan. And you heard the components are hydrocortisone, fludrocortisone, and salt. And one of the things that I really want to stress is this may be a tough call as your kids move into adolescence. And so what's really, really important is getting your kids on board and walking that very fine line between not making them terrified of what the future holds or all the horrible things that can happen, and not making them overconfident to the point at which maybe they'll try, okay, what happens when I admit that second dose of hydrocortisone? So it's a tough walk. It's got to begin early. You've got to help them become autonomous. And if there's one thing our adult colleagues can't stand when we transfer our type 1 diabetics or many of our very rare disease patients to the adult world, they say, oh, your patients are so mollycoddled. They're so, you're all mère poule, we say in French, mother hens. In part, it also has to do with you guys as parents helping your kids become autonomous. Make sure when you get a prescription that you always have enough pills that'll cover your stress dosing days. That's very important. And develop a relationship with your pharmacist so that he knows if you go back there and you need a few more pills, he'll right away give it to you. Beware of gastroenteritis. We just heard. How do you do that? Well, you train your kids from the time they're toddlers to wash their hands often, and watch out when you travel in countries where you know you might not have the best hygiene. And I have never discouraged the families that I have followed that have children with APS-1 from traveling. And they have traveled many countries of the world. But the two things that I do is I always give a travel kit to them. And any of the patients that are particularly susceptible, I have, you always have little kids that sometimes get tons and tons of ear infections or bronchitises that move sometimes into pneumonias. You have to maybe sometimes give them some oral antibiotics as well. And I like to always anticipate what country they're going to and try to make a contact with somebody in a major city in those countries. And since our patients have very simple treatment plans, which outline what the diagnosis is, what the ongoing problems are, what the medications are, and attention to potential adrenal crisis and potential severe hypocalcemia for whatever reason. And then finally, know the rules for stress dosing and have your kit. And now I want to see how many of you are actually carrying an Activile in your purses. Okay, it seems like I have a lot more hands up than I actually have hands up now. And that is a little bit concerning to me. So you're gonna need to think about that a bit more. Okay, let's talk about rule 2. I want you now to define in children the level of stress and know when to seek medical attention. And the way we define our stress is we define it by levels, level 1, level 2, and then level 3. So level 1 stress, you've heard, that's a fever that's going to be greater than or equal to 38, but less than 39. And I tried to make a Fahrenheit comparison, but I'm really Celsius. So the first level, 2 times the usual dose. And you do it for the 24 hours without any fever. You're gonna have copies of these slides. I'll be happy, you don't even have to take pictures. I can give them all out, it's not a worry. Level 2 stress, that's the higher temperature. And there you're gonna give 3 times the usual dose, again until 24 hours without fever. You're also going to consider a level 2 stress, and I think this was very nicely said for the adults. We say the same thing. When you have a baby who's not able to keep fluids in, they're having diarrhea, they're vomiting, or they may have signs of hypoglycemia, and you know those signs, the nausea, the lethargy, the pallor, the jitteriness, or the tremors. If you see that, you've got to immediately get them their hydrocortisone, and if they don't react rapidly, then you're going to start thinking, okay, maybe we're actually a level 3 stress, and you do not want to wait around, you want to get to the hospital. What is not considered stress, and I have the hardest time with parents with this, because they want a double dose for school examinations, because they think their adolescent's really worried about passing that exam, or they're going to have their first job interview to work at McDonald's and they're really scared. Or maybe their girlfriend just dumped them. I don't consider that a stress. I do consider stresses, obviously, the death of a very close person. And on that scale that was published a long time ago, I think divorce also ranks up there pretty high. But I don't have to worry about kids in divorce. It's really their parents and how their parents handle it. Okay, I do want to mention, and I put it on this slide, because many parents have those little things that measure the temperature in the ear, or they'll do rectal temperatures, and so there is a bit of an adjustment for what under the tongue temperatures are that I give up at the top, and I leave them there for you to just remember. So what do we do when there's no improvement, or if there's a loss of consciousness? Well, the reason I'm showing this, and here's the little thing, IV rapid onset, 15 minutes, 30 minutes, man, you've got a peak. When you're taking oral, it's quite a bit slower, that's the blue line, but at least when you give IM, hydrocortisone, you're getting it up there pretty rapidly. And so that's why we teach everybody about IM hydrocortisone. And, that sometimes does avoid those visits to the emergency room. So what do you need to do? You need to prepare for the injection. You have the Activile. We have a couple of new formats that are going to be coming out that are going to be easier to mix and inject. I don't have any in Canada, and I haven't been on any trials using them, but maybe my colleagues have. Anybody here among the physicians been involved in the development of these auto-injectors? Okay. One is going to be a needleless, and one is going to be a pen that rapidly mixes. You have usually the yellow stopper, that's what we give at home, but when you're up to 100 milligrams with the yellow stopper, that's a pretty big volume, that's like 2 mLs. We can get the red stoppers in the hospital, and sometimes our pharmacies can get them out as well. It's a slightly lower volume for adults. I don't know if you ever give out the red stopper among the adult patients that you treat, but I think it's a possibility. So you need all your material, you need it all ready and in a little kit that goes with you when you travel. I'm not so fussed about the alcohol wipes and the Band-Aid. I mean, I think when you're in an emergency situation, I don't really worry about that. But as a physician, I'm supposed to tell you that you always have to pay attention. These are single-use vials anyway. You can't keep them and reuse them, huh? You cannot reuse them. You have to throw them out and get another one. How much and where? Okay, so these were the amounts in Canada. On our Canadian card, we have less than 3 years, 25, 3 to 10, less than 10 years, 50, and then 10 years and older, 100. And I show the sites here, and I am not going to confess who my model was, but maybe many of you can guess, because it doesn't look like a little baby. Anyway, when you're giving it in the buttocks, which is a really good place for little babies because they usually have nice, sweet little buttocks. It's always the upper outer quadrant. When you're giving it in the thigh, it's the mid-external region. You're going to have these slides, don't worry, unless you want to show. Not allowed to post these anywhere. Huh? And another good place for adults, especially if they're, it's easy accessible, is the deltoid muscle here in the shoulder. So just keep those places in mind. The instructions come with how to do it. You got to push down the top, you got to gently agitate, you got to flip off the plastic covering, disinfect or not, get your sterile needle in there and give your dose. And I put a really nice video, a YouTube video, and I would honestly really encourage all of you, at least once a year, go back and look at the video and tell all your relatives, your parents, or your siblings who are taking care of your child occasionally, make them look at the video. Practice does help, and it relieves that horrible stress when you're trying to take a 4-year-old kid that may be in a crisis situation and administer it. You need to be aware and see it. And usually in our hospital, our nurse will go over the technique minimally once a year or whenever a family asks it. And we try to bring in the case of divorced parents, in our province in Quebec, 50% of our children come from divorced parents and reconstituted families very often. So often we're teaching two sets of parents, and we keep them on separate sides of the room in case they don't get along. Rule number 4, and this is really important. Parents and family need to be proactive. You can't just sit back and expect the medical teams, the healthcare professional teams, to do all the time the right thing. You got to be on top of them. And I'm really sorry that education sometimes is lacking, specifically for rare diseases. But you need to know how to interact at every level with the paramedics, with your hospital emergency department, and obviously with your treating physicians. So what are the must-knows? Well, before you call 911, which is our emergency number, give your IM Cellular-Cortef. Give it. Just give it and then call. Make sure you use the appropriate terms. Like, don't start off with, oh, my child has APS 1. Go right to the jugular. My child's in acute adrenal failure. My child's in adrenal crisis. You can use the word Addisonian crisis or Addison's disease. The point being that these emergency teams now have coded triaging in order to judge the emergency, the level of emergency. And so using the right words when you're calling in for an emergency is really important. Have your child's 1-page treatment plan and your medical kit with you. In our province, we do not yet have approval for our first responders to give intramuscular hydrocortisone. I am working really hard with my fellow endocrinologist to try to get it on the approved drugs for administration. They can give glucagon, obviously. They can give adrenaline. There's tons of things they can give, but for some crazy reason, they can't yet give hydrocortisone. And that's why I tell you, give your Cellular-Cortef intramuscularly before you call the first responders. And then bring all the child's usual medications with you. And of course, your child, if they don't have a bracelet or they don't have a necklace, maybe they'll have a tattoo. Don't be too upset if they decide to get a tattoo. It's not a bad thing. Just make sure that when they get a tattoo, it's not something artsy-fartsy that doesn't really get to the point, and they need to imitate the serpent sign. The one I like the best is sort of the imitation up here of exactly what you see on the medical alert bracelets with the serpent and the staff. And I like this one too because it says no adrenals, and that's pretty correct. Rule number 5. Show the triage nurse a document stating the medical condition and the urgency of medical attention. And yes, that little card is good, but in our hospital, and I realized I just grabbed this off our website and I didn't do a good high resolution of it, and it's in French, so it's probably good you can't read it. But basically, this is what we give to our patients, and if they don't happen to come to our hospital, it's still really good because it does tell them exactly, it tells the ER people exactly what to do, and it tells them that they're a priority triage patient. And rule number 6, you've heard this, all glucocorticoids are not the same. First choice, PO, IM, IV, hydrocortisone. Second choice, PO, prednisolone, intramuscular, methylprednisolone. And when you're looking for replacement of your fludrocortisone, don't forget that one of the reasons we like hydrocortisone is because it does have mineralocorticoid activity, and that little blue arrow is just pointing to the equivalent doses you have to give, especially of prednisone, in order to have the equivalent effect of 0.1 milligram of fludrocortisone. So you can see that's a message that you were already given by my adult colleagues. I think it really needs to be taken to heart. I'm stopping, and I'm just giving you some questions that you might want to think about in case they happen to ring a bell for you and, oh yeah, I wanted to ask that question. Otherwise, I invite my adult colleagues to come on up and we'll take any question. Thank you.